Welcome to our lecture on the causes and costs of global COVID-19 vaccine inequity. So the question that we're asking is, what do you think are the biggest challenges in ensuring global access to COVID-19 vaccines? And this article and presentation will provide some of those challenges. So the article starts off by looking at the unequal distribution of COVID-19 vaccine. So the COVID-19 vaccine was developed rapidly but distributed unequally. High-income countries, greater than 70% had a vaccination rate, and low-income countries about 30% vaccination rate at the beginning of the distribution of the vaccine. This is a great chart showing high-income countries and the people fully vaccinated per 100 population. It's the yellow. And then you can see the low income and where they were with respect to vaccination. So the key causes of vaccine inequity. The biggest cause was vaccine nationalism. So basically the hoarding of the vaccine by wealthy countries. So vaccine nationalism occurs when governments sign agreements with pharmaceutical manufacturers to supply their own populations with vaccines ahead of them becoming available for other countries. So we saw that a lot with the wealthier countries, Canada included. Limited manufacturing capacity in low-income countries was another cause. Number 3, the poor healthcare infrastructure that is already present in developing nations. Number 4 was vaccine hesitancy. And number 5 was something called intellectual property restrictions. And this is how pharmaceutical companies can block access to low middle-income countries. And it's a policy called the TRIPS policy, Trade-Related Aspects of Intellectual Property Rights. It's a neoliberal policy, and it has patent laws where it delays the market entry for generic drugs into countries. There's high prices of medications, there's market exclusivity, and it prevents local manufacture of generic products. So the cost of vaccine inequity, these are the health impacts. First of all, there were many preventable deaths and illnesses in low-income countries. And low-income countries already have less resilient healthcare systems when COVID-19 hit. And this led to a disruption in other health services in those countries, such as routine immunizations. And I saw in Ghana a rise in measles because of this. And then because of this, and because of not vaccinating individuals in other parts of the world, there was risks of new variants emerging of COVID-19. The economic impacts. There was a slower economic recovery in developing nations because of the lack of the vaccine, and people were becoming sick. And there was a lack of the vaccine to help people to prevent them from getting the virus. So there was less productivity in these countries because of more people becoming COVID positive and not having the vaccine. And that led to widening economic gaps between the rich and the poor country. There was also educational losses, so the social impacts, the educational losses, especially for children in poor countries. Poor countries reported the longest average disruption or duration of school closure. And then again, this leads to the exacerbation of already existing inequalities. So we've got health impacts, economic impacts, and social impacts. What about the global cost of inequity? Well, we saw during the end of the COVID-19 how the pandemic disruptions were worldwide and that there were economic losses to high-income countries because the low-income countries were the ones who were the supply chains, and the supply chains weren't back on board. And then the risk of these new variants not only being in these low middle-income countries or the global south, but spreading to all countries. So that's the global cost of inequity. So the recommendations are to increase vaccine manufacturing capacity globally, especially in low middle income countries, to allow them to produce their own vaccines. The importance of sharing intellectual property and technology without restrictions strengthening healthcare systems in developing countries, addressing vaccine hesitancy through community outreach, and developing binding international agreements to make sure that we are prepared for the next pandemic. And how can we prevent this nationalism, this vaccine nationalism? And so the conclusion is that vaccine equity is in the global interest, and we need to prepare for future pandemics. When we prepare for future pandemics, we need to ensure that we're addressing all the inequities that were discussed. So the reflective question is, I want you to think about how can nurses contribute to reducing health disparities during future pandemics. I want to speak briefly on the binding, something that when we talked about one of the recommendations as being a binding international agreement, the WHO has put forward the Pandemic Accord or the Pandemic Agreement, and its motto is prevent, prepare for, and respond to pandemics. It's a potential international agreement between 194 countries, and it's necessary that we get this Pandemic Accord or agreement passed to address the weaknesses and lack of cooperation that we saw during the COVID-19 pandemic. So there have been some arguments, unfortunately, against the Pandemic Accord or the Pandemic Agreement, and it hasn't been signed yet. The four big arguments are sovereignty concerns. So countries feel that they'll lose some of their autonomy to the WHO because it's a binding obligation. Economic and political pressures, the cost of compliance, and geopolitical rivalries, in that one country says, I'm not signing because another country is signing, and we have some geopolitical rivalries. And if another pandemic happens, I don't want to be giving my vaccine to that country. The rise of nationalism, where countries are kind of holding on to their own and only protecting their population, and the skepticism of national agreements. And then the sharing of intellectual properties, because what would happen in the pandemic is the TRIPS agreement would need to be waived during pandemics. So this is something that nurses can really fight for, is to ensure that countries try and see the really importance of signing this Pandemic Accord and the Pandemic Agreement. And this is something that the International Council of Nurses has really been pushing for nurses to advocate for their own country, to push their own country to sign the Pandemic Accord to make sure that we have equity if we have another pandemic.